Well, hello everybody and welcome back to the Sensitivity Doctors. We had such an interesting guest today, Dr. Izabella Wentz, and we spoke about something I actually don't know about, which is Hashimoto's, but that Dr. Amelia Kelly is very familiar with. And she was so nice, she was so calm, and she was so well spoken. She really explained it so well.
I know it can be a very confusing diagnosis to understand, but Dr. Wentz is an integrative pharmacist. She's been dedicating her life to finding the root causes of these autoimmune issues, and her book actually came out 10 years ago, but I stumbled upon it through my own health journey recently. It's a New York Times bestseller, Hashimoto's Thyroiditis, Lifestyle Interventions for Finding and Treating the Root Cause. It's a really good book, honestly. I think even if you don't have autoimmune issues, it's just a great book for feeling your best in general.
Nice.
But I think my favorite thing about her today was that I felt like no question we asked was she was open to everything. She was open to every angle. And even when I kind of challenged her a little on the gluten thing.
Yeah.
So if you want to learn more about managing your Hashimoto's or thyroiditis and or being a highly sensitive person who has autoimmune issues, which is very common, enjoy. Well, I'm so thrilled that you're here. I actually found you. One of my favorite ways of finding guests is reading a book, getting totally into it, loving it, and then just dying to talk to the author. So I'm just so thrilled that you're here today. So Dr. Wentz, could you tell our listeners a little bit about who you are and what you specialize in?
Sure, and such an honor to be here with you. I'm so excited to talk about sensitivity and Hashimoto's. Hashimoto's being my specialty, I became a Hashimoto's expert by ways of becoming a human guinea pig. I was already a practicing pharmacist when I realized that a lot of the symptoms that I was feeling just were not normal to have as a 20-year-old. I had carpal tunnel, I had extreme fatigue, hair loss, new onset panic attacks, all kinds of issues with cold intolerance, sleeping excessively, and so on and so forth. And I became diagnosed with Hashimoto's in my 20s. Once I got the diagnosis, I was initially excited to try medications being a pharmacist. That's sort of our hammer, and everything's a nail, right? But the medications only helped a little bit. And then I realized that most thyroid disorders come from an autoimmune attack against the thyroid gland. And so I was wondering if there was anything I can do to minimize, reduce, or prevent this type of attack on my thyroid gland and really get rid of all of the symptoms that I had been dealing with. And so I ended up being able to get myself into remission, getting rid of all of my annoying frustrating thyroid symptoms, and coming up with a book called Hashimoto's The Root Cause. And it's been over a decade now, and I'm really focused on helping women primarily, but also men take charge of their own health when they have Hashimoto's and to teach them ways they can help themselves.
Well, it's pretty wild because I probably could have benefited from your book 10 years ago when it came out. But so Dr. Jean and I were just talking about this before you joined us today. I've been on thyroid medicine for 20 years now. So this is something that runs in my family. I've been diagnosed early on, probably early 20s, similar to you. However, I did not discover that I have had Hashimoto's until by chance, I'd say 6 months ago, I went to my checkup. I'm having a casual conversation it was actually a PA who was seeing me, and she mentioned something about her Hashimoto's. And I said, oh, well, I have thyroid, I have hypothyroidism. I don't have Hashimoto's. And she looked at me and said, well, hold on one second. And she dug into my chart and said, actually, you were diagnosed with Hashimoto's 5 years ago.
Wow.
Can you maybe just clarify for those of us who don't know, what is Hashimoto's?
Sure. It sounds like an exotic Japanese sword fighter.
I know. Yeah. Why is it even that name?
It's named after a doctor that discovered the condition about 100 years ago. It's been a little bit over 100 years. And still a lot of people don't know that they have it. It's a very, very common condition affecting 1 in 5 women. And majority of those who are told that they have hypothyroidism or a sluggish thyroid I would estimate anywhere from 90 to 97% of people who take thyroid medications or have hypothyroidism actually have Hashimoto's. And
That's a lot.
it's a lot. And I think a lot of people just don't know. They don't know that when they have a low thyroid or hypothyroidism or slow thyroid function, that they have an autoimmune condition and that they're at risk for additional autoimmune conditions and that they need to do a lot more than just, take thyroid hormones. So what it is essentially the immune system starts to recognize the thyroid gland as a foreign invader and launches an attack against the thyroid gland. In the early stages, people may just have symptoms like anxiety, and they might have panic attacks. They might have obsessive compulsive thoughts, and they may get referred to a psychiatrist instead of getting their thyroid function tested. In the early stages, the thyroid function could still be normal, but there's still this autoimmune attack that can be related to causing numerous symptoms. And as the immune system continues, enough of the thyroid gland becomes destroyed to the point where a person has hypothyroidism. So it's essentially the condition that causes hypothyroidism if you've had it long enough.
And hypothyroidism, is that when your thyroid is overactive or underactive?
Hypothyroidism is when the thyroid is underactive. So we typically think active thyroid is going to be slow, sluggish. So that's maybe associated with brain fog. That is going to be associated with fatigue. We're going to have hair loss, although that does happen in overactive thyroid. It's like hair is never spared. We're going to have weight gain. We might have slowed reflexes, cold intolerance, and a slowed metabolism. So this is something that majority of the times women are diagnosed with. For every man that's diagnosed, there will be anywhere from 2 to 5 women.
Why do you think it's so much greater in women?
I think, looking at all of the different factors, I think definitely hormones play a role. So thyroid disorders are definitely going to be, their incidence is going to peak around pregnancy, puberty, and perimenopause. And so we think thyroid female hormones are at play. And I feel like women are just a little bit wired differently. And so we're more susceptible to our environment. And hypothyroidism is, when you think of hibernating bears, that they are able to collect so much excess body fat and their basal metabolic rates slows down to survive winters and just sleep, they're actually hypothyroid. I don't think a lot of people know that, but hibernating bears, they get into that hibernation state and their thyroid function slows down. And so what I like to think about from a perspective of evolutionary physiology is I feel like women, we're more tuned into the dangers and the nuances of our environment. And so if we're sensing that for whatever reason our environment isn't safe, then we're more likely to have a slowing down of thyroid function. And this may serve as a protective role. If there was a famine, us hypothyroid girls would be more likely to survive, right? Because we wouldn't need as many calories to survive. If there was a war, if we were to hold back and rest in our caves, we would be less likely to be killed. If we, we're going through some tough times, fertility is also a side effect of hypothyroid. Fertility issues are also a side effect of hypothyroidism. And of course, we know that the best time to get pregnant is definitely not when we're trying to run for our lives, right?
Fair. It's interesting that you mentioned that. We actually had a guest earlier who we were talking about sugar addiction with. And my family's history of being starved out of the Ukraine, not this generation, but the generation leading up to my genetics, we had brought that up. And now it's making me wonder a bit of, is that ever as trauma in families? Is that something that can kind of turn these markers on, you think, for hypothyroidism or thyroid issues?
Yeah, it's definitely interesting because we might have genetic predispositions, but what turns on hypothyroidism? So I grew up close to the Ukrainian border in Poland.
Oh, wow.
And I was in Poland when Chernobyl hit, and we were very, very close to Chernobyl. So I believe a lot of women and children that were in that vicinity, they were more likely to have thyroid dysfunction. And studies looking at children who were downstream from Chernobyl were more likely to have thyroid dysfunction compared to, other Ukrainian children that were maybe on the opposite side. And you can argue
Wow.
that genetically they were very similar. And of course, we know that thyroid cancers were going to be higher with that exposure, but also autoimmune thyroid disease. And so, it's an interesting question. I can't go back in time and know what my ancestors went through. At the same time, there are some anecdotes about the Irish potato famine, suggesting that the people who were more likely to survive it were hypothyroid. And so perhaps they passed on
Oh.
more of those genes, or those genes were turned on. So I think it's very, very interesting looking at what causes thyroid dysfunction. We know that it's not a purely genetic thing, right? So we have the predisposing genes, but there's something in our environment that can turn it on, whether it's in this generation or a previous generation, right?
And so when you were talking about being vigilant to your environment, also, it makes me think of what we were so excited to talk to you today about is the impact that thyroid function can have on sensitivity, and also the impact that sensitivity can have on thyroid function. So this kind of dual situation that can happen potentially for highly sensitive people or people with more active nervous systems. So good luck answering that. It's a big question.
It's a big question. I think it's definitely a two-way street. So I feel like people who are highly sensitive and may have an overactive limbic system or more reactive nervous system, this can make Hashimoto's symptoms feel much more intense. I know my son is very highly sensitive, and so you can scratch him, or you could rub a little bit of something on him and it hurts, right? And
Mm-hmm.
so I feel like people who are highly sensitive are more likely to experience more severe symptoms of hypothyroidism or Hashimoto's. I feel like they're more likely to have chemical sensitivities or multiple chemical sensitivities. They're also more likely to react to various supplements and medications. So we're oftentimes thinking about, okay, like we're going to start low and go slow with you more so than we would with another person who maybe wasn't as sensitive. And then I think the other component of it is highly sensitive people feel so much, and they feel the environment, and we feel everything around us more intensely, and they may be more susceptible to traumatic stress, and that's staying with them. And so when we have traumatic stress can of course be a big predisposing factor for a lot of autoimmune conditions. And I do see, some of my clients have identified as highly sensitive, some of them have not. But in the ones that have, I do see the really big rates of chemical sensitivity and that adrenal dysfunction, sometimes with copper toxicity or mold toxicity. And they're sort of, and I won't say everybody, but in my kind of bias, I guess they're more likely to be the canaries in the coal mines.
I know that Dr. Jean, you have different autoimmune issues happening with your gut, correct?
Yeah, I don't have autoimmune. My mom is very, sadly, she has many. She has Sjogren's disease, she has lupus, which, we've been told can happen from the Sjogren's disease or syndrome. But for me, I just have a panic disorder and irritable bowel syndrome. And I have the mix where you have both constipation and diarrhea, and you struggle with them both. But luckily, so far, I feel like I've been blessed with enough challenges. I haven't been not an autoimmune yet, but I know that it is genetic and that we should be tested. Yeah. Is that correct? Sorry, no, I just saw your face, Dr. Wentz. Is that correct or not?
So I have an upcoming book about irritable bowel syndrome, and I will say
Oh,
that it's coming out in 2026. Irritable bowel syndrome was the symptom that I had initially before my Hashimoto's diagnosis. And going through functional medicine training through the Institute of Functional Medicine, I guess whenever looking at creating patients' timelines, we oftentimes will see that irritable bowel syndrome will occur 5 to 10 years before autoimmunity does. So my opinion is if you can address the irritable bowel syndrome, you can prevent the onset of autoimmune disease. So it's one of those
hmm.
things where the science and the research has found that three things need to be present in order for autoimmunity to manifest. And one of them is that genetic predisposition we've been chatting about. Another one is the triggers or the environmental factors that we had talked through. And then the third one is going to be intestinal permeability or leaky guts, which, this doesn't have symptoms, but when it does have when people with irritable bowel syndrome are very likely to have intestinal permeability or leaky gut. And so that's something that is actually one of the bigger things I do for people with Hashimoto's is we focus on their gut health to enable them to get their Hashimoto's into remission. So I feel like definitely treating and finding the root cause of IBS is something that I would recommend for people who have that and want to and have a family history of autoimmune disease and want to prevent autoimmunity.
I've actually been through the FODMAP diet recently, but the same people from the Monash has brought out this Nerva app. Have you heard of it? It's a gut hypnotherapy, but it's exactly the same doctor that did the FODMAP. And I have to say, like, nothing has worked as good as that. Nothing. My entire life changed since I did that Nerva program. It's incredible.
There's a big mind and gut connection, and I haven't heard of that program, but I do have concerns with the low FODMAP diet because the diet can be very helpful as short term.
Yeah.
And it can help with symptom management, but when used long term, it actually lowers the diversity of the gut and doesn't help resolve the underlying reasons why somebody was sensitive to FODMAPs. And so this could be because of SIBO. So if you have SIBO, small intestinal bacterial overgrowth, then you're going to be sensitive to FODMAPs. If you just change your diet and the SIBO persists, then you're not necessarily going to heal. So oftentimes you do need to address the SIBO component. And then there's a whole, of course, mind-body gut connection that I think is a very important part of the healing journey for a lot of people. So it sounds like that app is focusing on that. Is that right?
Yeah, it's definitely the mind-gut connection. And I did do the SIBO test and I was negative, luckily.
Right. For people who don't know what you're talking about, because I don't, what is SIBO?
Okay, SIBO is small intestinal bacterial overgrowth. It's one of the causes of irritable bowel syndrome. There are additional causes, however, so these can include protozoal infections. The most widely studied one is called blastocystis hominis. It's also a common root cause of Hashimoto's and chronic hives. And then there are food intolerances, celiac disease. Sometimes people might have malabsorption of various reasons, or they might have bile acid malabsorption. So there's a whole host of different reasons for irritable bowel syndrome. One of them is SIBO. I think that one gets the most attention, but it's not the only cause too. So little preview of my upcoming book in 26.
Which I'm sure Dr. Jean will run out and get.
Oh yeah, for sure.
So I'm curious, being someone in the mental health field, I work with generally a lot of women, a lot of trauma, some men for sure. And I encounter quite a few of my clients who come in with a laundry list of autoimmune issues. And it feels like if they have one, they have this one and then that one. How do we organize? Like, is it necessary to understand the differences between them? Is it better to look at it as a general autoimmune response? That's kind of my first part of the question. And my second part is, with that in mind, you use the term root cause, and I love that. And that was a big part of your book. How do we address the root cause then? Because it kind of makes me think of when someone comes in with trauma and they also have anxiety and they also have depression and they may also have inattention. Usually the same coping skills that will address trauma can also help with depression, can also help with anxiety. So it's like we can piece it apart, but sometimes I find it even simpler to just say, let's choose the root, let's address the root, and then the others can be addressed by proxy.
Yeah, I think you nailed it. It's essentially autoimmunity, whether you have Hashimoto's or rheumatoid arthritis or another Sjogren's or lupus. A lot of times there's very foundational things that are going to help each condition. So for example, there might be food reactions that are implicated. They might be an impaired stress response, whether that is from ongoing stress or past trauma that you work on with your clients. That's so important. Or it could be nutrient deficiencies. It could be some chronic infections, poor ability to handle environmental toxins. All of these things do contribute. I do find a lot of times when I will work with people on Hashimoto's, all of a sudden their alopecia areata, when they're missing patches of hair, they'll say, okay, my hair is coming back, and Sjogren's, I'm not having symptoms of this anymore. I'm not having symptoms of that anymore. Oftentimes I will say with many conditions, Hashimoto's specifically, there might be slight tweaks we might do. For example, with Hashimoto's, we might want to focus on thyroid hormones or thyroid specific nutrients to really rebalance that. We might focus on some red light therapy to see if we can help with some of the autoimmune inflammation. For something like ulcerative colitis or Crohn's disease, we might focus on a heavy-duty anti-inflammatory support, or we might focus on like a semi-elemental diet to really heal up the gut before we do anything that can be more inflammatory to the gentle gut. And so we might have different things we might do. For somebody with RA, we might be focusing more on like physical therapy or ways to really support their pain relief, right? So I think I would say probably 80% of what we would do is very similar for autoimmunity in general, but then there's going to be those specialty things that we might do for symptom management for that particular autoimmune condition.
So for Hashimoto's in particular, or thyroid issues in particular, what do you think are like the top most important things to address the root causes? And I'm asking this somewhat selfishly because it can feel like a lot. I mean, I saw you had a post, I think it was yesterday or today, where you were talking about like foods that seem healthy but aren't. And I saw seaweed snacks on there and my heart broke in half because I love seaweed snacks. And so I'm so confused because on one end, I'm thinking, oh, it has iodine and good stuff in it and it should be good for my thyroid. But then on the other hand, it was on your naughty list. So I don't know, like, how do we organize, at least just with Hashimoto's in general, like what are the most important things to do to address the root cause, in your opinion?
I think speaking of nutrient deficiencies and nutrition, these are things that everybody can primarily do on their own. So for nutrition, the biggest thing I recommend is going gluten-free and focusing on blood sugar balance. For most people, this means more protein and fat and lower carbs. If you're like keto or carnivore, then maybe, maybe not the same, but adjusting your diet might help. And then really, some people might also be sensitive to dairy and soy. So figuring out which foods really trigger your symptoms is going to be very, very important. Then looking at some of the common nutrients that are deficient in Hashimoto's would be selenium, myo-inositol, thiamine, magnesium, vitamin D would be a great place to start for most people. And then toxins. So what are some of the things that are in our environment that are low-hanging fruit that can cause issues with thyroid toxicity? And one of them is iodine excess, unfortunately. I think public health officials, being very well-meaning, they found that not enough iodine could cause hypothyroidism because of iodine deficiency. And so they said, let's help the whole entire world and put iodine in the salt supply. And unfortunately, what has happened, and various studies have confirmed this, is that the rates of iodine deficiency hypothyroidism went down, but the rates of autoimmune hypothyroidism doubled, tripled, sometimes quadrupled. And so now iodine excess has been recognized as an environmental trigger.
Ooh, so it's like that sweet spot you need to find with that.
Yeah, somewhere, the amount that's in a prenatal vitamin or a multivitamin is going to be safe and helpful for most people with Hashimoto's. But when we're getting to these mega doses, so the amount that you'd find in seaweed snacks and so on and so forth, that can be excessive for many people with Hashimoto's. I've had some clients that had new onset Hashimoto's because of eating a lot of seaweed and megadosing themselves with iodine. And then fluoride is another common toxin that recently it's been linked to lowered IQ in children. And I think part of that is
Wow.
because of its impact on thyroid function. Back in the olden days, it was used to suppress thyroid function when people's thyroid was overactive. And some studies have found a connection of communities where there's more fluoride in the water supply versus less, having higher rates of hypothyroidism in those communities. So getting like a fluoride filter can be helpful for a lot of people, or eliminating the use of fluoride in their toothpaste, potentially doing something like hydroxyapatite in their toothpaste might have the same benefits without some of the drawbacks. So that's a great place to start for a lot of people. And I have had people who go into complete remission with utilizing some of these steps. And of course, I also have some deeper guidance in my books, and we can talk about them here as well. But sometimes I think, like you said, it can feel a little bit overwhelming when you're like, of all the things you need to do. I tend to be very comprehensive. So I'm like, oh, I had this one client with this. Let me tell everybody about it, even though it might not be relevant for you. So like breast implant illness or mold toxicity. I've had clients with Lyme. I've had clients with all sorts of issues that basically got their immune system out of balance. And so I like to share everything that I have learned with people, even though not everything might be relevant to you as an individual, right?
When you said the thing about gluten, I know that's number one, the first thing I always hear when it comes to Hashimoto's. I had this very frustrating situation with that PA when I was speaking to her, and I'm really curious your thought on this. I had said to her, is it enough to reduce as opposed to eliminate? And she said, as you would probably expect, no, it's really crucial to reduce, or really crucial to cut it out. Okay, I understood that. And then I said, well, what happens if you accidentally have some, or it's Christmas and grandma made the most amazing sugar cookies and you want to eat one because you just want to? Are you eliminating all your progress? And she said something along the lines of, you need to have 3 months with absolutely no gluten in your body for it to be making an impact. And anytime you get any gluten in your body, I mean, it was so intense what she was saying that I walked out kind of feeling like a doomsday feeling about gluten right off the bat.
Sure. Yeah. It's kind of like being a little bit pregnant, right? With gluten. Very, very sensitive to it. If you have celiac disease, then even a tiny, tiny bit can really mess up your progress. And I would say 90 days would be a minimum to see full healing of the intestinal tract. We know that not everybody with Hashimoto's has celiac disease. So there are different causes. There are different reasons why somebody might be reacting to gluten. Potentially it's cross reaction with thyroid antibodies in the case of Hashimoto's, or non-celiac gluten sensitivity, or SIBO, or another driving cause behind it. All that to say is that your sensitivity to gluten may vary widely. So if you're super sensitive at the extreme of celiac disease, you absolutely do want to say goodbye to it. Figure out how to make your own gluten-free sugar cookies that are just as good, if not better, than your grandma's, right? And that's how you need to be. If you're somebody with Hashimoto's, I really would do my best to stay off of gluten as well. You will typically see results if you have been gluten-free within a few weeks, sometimes within a few days. For some people, it may take 90 days to see the full results. As far as, what to do if you've had a little bit of gluten, I think, I would defer to you, but I know some people may sabotage their progress. And so I really try to teach people to care for yourself. And, if you know that something isn't working for you, then you shouldn't be eating it. And I know a lot of my clients, once they do an elimination diet and then they try gluten and then they feel so sick and all of their symptoms come back, they know like being gluten-free is a form of self-care for them. Now, not everybody will feel the effects of gluten in their bodies, but I would say the majority of the people that I've worked with do. So when they go gluten-free, they just see such a big difference that they're like, oh my gosh, I'm never going to eat gluten again. And then there's about, in my outcomes survey that I've done with my clients and some of my readers, about 88% of them do feel much better gluten-free. And there's about 12% of people that I've worked with that will be like, I'm off gluten, I'm on gluten, it makes no difference for me, right? Like, it doesn't matter if I eat it, doesn't matter if I don't eat it. So that's been my experience. And yeah, I think sometimes the truth can be painful, right?
Right,
Or they could set us
absolutely.
free.
What are the things that signal that it's really working for you? You said a couple times they'll have really great results. What would you say are the top results?
Okay, so here are, I've seen some incredible transformations where people's joint pain just disappears. Their irritable bowel syndrome symptoms disappear. Their acid reflux symptoms disappear. The inflammation from their body drops. Their brain fog improves. Their energy improves. I'm a pharmacist and I'm a big proponent of taking the appropriate thyroid medications. I'm often recommending T4, T3 containing medications with the active thyroid hormone in them. Yet my clients and readers have said that utilizing the gluten-free diet for many of them was even more helpful on their core thyroid symptoms than getting on like the most helpful thyroid meds. So
Wow.
it can be a really, really big game changer for a lot of people. In my own personal journey, I had carpal tunnel in both arms. I had acid reflux, irritable bowel syndrome, bloating, no matter how many sit-ups I did or how many Pilates classes I went to. And within 3 days of going gluten-free and dairy-free, like all of that vanished. My carpal tunnel took about 2 weeks to get better. And I had these symptoms for 5-6 years. So at that point, I was like, you know what? And I'm a Polish girl, so I was like, I don't have to eat pierogi again. It's fine. Like,
It's the best.
you can make them gluten-free. And I will say with
Yes,
time,
sure.
I can eat most foods. I haven't eaten gluten in about more than 10 years other than on accident, but I've been able to introduce like dairy and soy and all of the other things. So I am working on like a gluten sensitivity protocol. I haven't found it yet, but I'm in progress. So I can keep you guys posted on that. But I know
Yes, please
sometimes
do.
the diets can feel restrictive, but oftentimes it's a short-term thing that we do to reset our immune system.
Shifting to one other thing that you had said earlier that I absolutely want to understand more fully is the anxiety component and how and why the thyroid impacts anxiety to the degree that it does. It's still a little, and why is it more anxiety than depressive symptoms?
That's such a great question. And when I was in pharmacy school, we got this picture of a woman cut in half, and half of her was hypothyroid and half of her had an overactive thyroid. And we had like symptoms on each side. And the woman with hypothyroid was supposed to be depressed, and the woman with an overactive thyroid was supposed to be anxious. Yet what I found and what the research has shown is that women with Hashimoto's and men tend to be anxious, right? And that's usually the first sign and symptom. Obsessive compulsive disorder, anxiety, any kind of feeling of unwell is something that they'll report, and not as much depression. Depression might occur in the later stages. So we do know that an overactive thyroid, it kind of ramps us up. So I like to think of it as if you had like 10 cups of coffee, how would you feel? You'd have insomnia, you'd have palpitations, anxiety, you'd probably have diarrhea. And that's what hyperthyroidism is. In Hashimoto's, we have a immune system attack against the thyroid gland. And so when the thyroid gland becomes attacked, a whole bunch of thyroid hormone gets dumped into our bloodstream. And so then we have this transient hyperthyroidism, and that's where the anxiety and the panic attacks can come from. And then once that gets cleared out, the person might feel more calm or they might get depressed. So definitely, I would say in the first 5 to 10 years before the thyroid gland is, I guess some people call it fully burned out, but I would say damaged to the degree where it can't produce enough thyroid hormone, we're going to see a lot of anxiety as the main symptom for many people. And it's very frustrating because people are told that it's all in their head, and they're referred to mental health when it could actually be, I think it's always helpful to have mental health strategies, but when there's like an underlying physiological cause, it's like, let's really address that. And I found selenium and myo-inositol can be really, really helpful for anxiety and then blood sugar balance, where people will be like, I used to be so anxious, and it turned out that a little bit of selenium and blood sugar balance, and now I'm like even keel. Where did that come from? Like, turns out I'm not an anxious person. So it's been quite interesting to see that, where how much the body impacts our mood, right?
And I appreciate what you were saying about being referred out because it's, quote, all in someone's head. Just like you were saying, you like to be comprehensive. I think the best ways to address things like mental health issues is comprehensive. So much as if someone comes into my office and they have the symptoms we're talking about, and maybe it's because I have it, so I think about it, I always ask, do you have a doctor that's checking your hormones? How's your vitamin D? Have you had your thyroid checked? One of the things that does irk me a little is when I had a brand new client come in who has a general practitioner who is doing her psych meds, her regular meds, and her thyroid meds.
Mm.
And that was concerning to me because I know that there's changes all the time in, kind of like the spectrum of what's considered normal. And is this GP able and capable and willing to do the full panel where they really test everything? I think, and correct me if I'm wrong, one of the ways to determine if you have Hashimoto's is if you have antibodies, correct?
That's right. So thyroid antibodies, thyroid peroxidase antibodies, and TG antibodies, thyroglobulin antibodies are going to be the most common.
Right. And so she now has since gotten an appointment with an endocrinologist, and her GP is very supportive of this. He's been trying to urge her, you need to find someone that specializes. And speaking of specializing, as I listen to everything that you're sharing, and when I was reading your book too, I have to admit, I had these moments where I was just wishing I could go back in time 20 years ago and give your book to me 20 years ago, because I feel like the way that I would have addressed my thyroid issues would have been completely different, because I never even knew about or thought about anything related to all of the root causes that you're saying. I just knew there's a doctor telling me to take this medication, and so I'm going to take it.
Yeah, I think things have been, I think a lot of us 20 years ago, I was just finishing up pharmacy school, and I used to think that all doctors were created equally. I thought like once I got my degree from pharmacy school, I would have like all of this information downloaded into my brain, right? And I would just know everything. And I thought every doctor and nurse and psychologist and physical therapist, that everybody was like at the top of their game. And it took me a little while to realize that wasn't necessarily the case. And I don't know if with that also came the shift that we're seeing in society where, you know what, there are other places we could look for answers. I think with the access of the internet at our hands, a lot of us have been able to look at published medical research in the journals by ourselves. We've been able to connect with other patients ourselves, and we've been able to, be citizen scientists in a way, to figure out what to do for ourselves, even when our doctors might only have a partial answer for us or not the full answer. I know many times the things that doctors learn in medical school are so far behind the medical research that's out there, that's coming out. And some of them, there's continuing education, but not everybody keeps up with it, or they might not be doing continuing education within your specific field, or the education they might be doing might be more focused on sponsored content, right? So sponsored by pharmaceutical companies. Like there's not like I don't think like there's a green juice company that's teaching doctors on how to properly, inviting them to dinners and telling them like, oh yeah, if you change your patient's diet, they're going to feel so much better, right?
Right. Wouldn't that be nice though? What you're saying reminds me of a really great conversation I think we had in another episode, Jean, where we were talking about medical gaslighting. And the necessity to do your research. And if anyone ever minimizes your knowledge about your body and minimizes what you read and says, I know the old term of, someone's trying to be Dr. Google. Yes, we all have this access. I mean, I joke sometimes, where are the doctors getting the information too? They're looking online, they're looking at journals. And so for anyone listening who thinks that they might have any sort of autoimmune issue, suspecting some of the symptoms that you had mentioned today, like brain fog, weight gain, irritability, anxiety, hair loss, joint pain, basically just feeling cruddy, to trust your gut and listen to your intuition and do the research and find a provider who wants to hear your perspective on your own body. For sure. So with that in mind, is there anything that if you were going to, really encourage listeners going forward, they end the episode and they think, I want to take charge and I want to get to the root cause other than giving up gluten, what would you like to tell them going forward? And where can they find out more about your offerings, your new book coming out, and just all the fabulous things you like to share?
Sure. I think definitely what I would want to say to people is if they think they've tried everything and they're giving up hope, they think they're just stuck to be existing as like a percentage of who they're meant to be or who they once were. It doesn't have to be that way. There's a lot of different strategies and there's a lot of different tools that you can utilize to get yourself feeling better, whether that's nutrition or counseling or utilizing supplements. There are like these methods that can be incredibly helpful on your healing journey. My book, Hashimoto's Protocol, lists out a whole bunch of different things, including very specific protocols that people can follow and a lot of the research. And then I also have a book called Adrenal Transformation Protocol, which is just a 30-day plan to really rebalance your stress response so that you can go from like living in survival to really thriving, getting your energy back, getting that brain fog lifted. And I see people's symptoms transforming every single day. You can work with one of my programs, but you can also just read my free articles. I have so many people that write in and say, hey, you mentioned thiamine and I took it for 3 days and it resolved my fatigue. I'm off of disability now. And, there are things you can do, and please don't give up on yourself. You're worth it.
Absolutely. Thank you so much. And thank you for having these resources. And I'm just so honored that you came to talk. I was absolutely so thrilled to read your book. You helped me in my journey as I discovered I had something I did not know I had. But thank you again, Dr. Wentz, and be well, everyone. Bye.
Bye. Bye.